Hello guys, welcome back to my channel and the lecture series on GI disorders. And in this lecture, I will talk about the indigestions, that is also called the dyspepsia. Actually, this is not a disease itself, it is the group of diseases, and the manifestations of that diseases could be named as indigestion or the dyspepsia. And at the end, you will be able to know that what is the dyspepsia and what could be the causes and the pathophysiology of dyspepsia and how we investigate the dyspepsia and what red flag symptoms may indicate that there could be malignancy like tumors in the GI, and we will be able to know about the approach, like if there is urgent endoscopy needed or not. And what is the definition of the dyspepsia or indigestion? Actually, the collective term for any symptoms thought to originate from upper GI tract, like if there is problem in the GI tract and there is any symptoms that appears, and that is the dyspepsia. That symptoms could be the bad digestions, that patients have not proper digestions, may present with some bloatings, and the epigastric discomfort may be present in dyspepsia. The patient says that he is full after eating some food, and the bloating may be present, the indigestions, that is also the dyspepsia as well, and the heartburn may be present, and the patient may feel fullness in his GI, like in the stomach. The patient may present that he or she has the acidic taste, or the vomiting may be present during dyspepsia. And what is the ROM III criteria for dyspepsia? Actually, this may help that when we name that disease dyspepsia, when during the previous 3 months the patient with no any structural disease, like the upper endoscopy is normal, and in previous 3 months the patient has the bothersome postprandial fullness, means after eating only some food that he says he is full, and early satiation, that is also the fullness after eating some food. Epigastric pain may be present, and the epigastric burning could be presented in that patient, and that is the diagnostic criteria for dyspepsia, and it is named ROM III criteria. And what could be the possible causes of dyspepsia? Actually, we have two causes of dyspepsia, the organic or the functional. When we do endoscopy and we see the pathological findings, we name that there is organic cause of dyspepsia, and we see that dyspepsia could be present due to gastritis and the ulcers in stomach. And the functional dyspepsia, that we don't see any pathological finding in on endoscopy, that is named as functional dyspepsia. And we have two types of the functional dyspepsia: the epigastric pain syndrome, that is the burning on the epigastric, and that is the epigastric discomfort, and that occurs during fasting, and the postprandial distress syndrome, that we feel fullness after eating. And in the pathophysiology, and there are many theories that have been proposed for the pathophysiology of dyspepsia. The gut-brain interaction is important. The patient who has dyspepsia, actually in gut-brain interaction, we see if some patients have received an antibiotic, they just feel a reduction in their symptoms. That could be the psychiatric problems in that patient. And we see that gut motility problems may be present, or the gut viscera could be hypersensitive, and The microbiome imbalance may be present. And we also talked about the genetic predispositions like the HLA may be present. And what could be the signs that may suspect us to the that patient could have the malignancy or other causes? That are the red flags, and these are associated with the serious gastroenterologic diseases. And these alarm features are red flags could be the chronic gastrointestinal bleeding, the progressive unintentional weight loss, or the dysphagia, or the pain while swelling may be present as a red flag. The persistent vomiting may be present, the iron deficiency anemia, or the pernicious anemia that could be due to the vitamin B12 deficiency, and the epigastric mass like the lymphadenopathy or other mass could be present in the epigastric area, or the age could be present as 60. All these red flags are very important while we diagnose or approach to the dyspepsia. And during dyspepsia, we need to approach and do the urgent endoscopy, or if we don't need the urgent endoscopy, what do we do? This is the approach. If the patient has the age more than 60, we do the urgent endoscopy. And if there is some pathological findings present, we see that the patient has the organic dyspepsia and we treat accordingly. And if we don't have any pathological findings, the functional dyspepsia could be present. And further, we do H. pylori test in those patients with endoscopy normal. And if the H. pylori test is negative, what we do? We just give the PPI to the patients. And if there's no improvements uh, after giving PPI, there's additional medications could be given by the doctor. And if the age of the patient is less than 60, and we just assess the patients with red flags. We see that if the patient has red flags, we say that that patient needs the endoscopy. If the red flags are absent, we again do the H. pylori tests, and if the H. pylori test is negative, then we give the PPI and ongoing these things. If the H. pylori test is positive in those patients, with the red flags absent and the endoscopy normal, we see that we give them the antibiotics to those patients. If the patient is not uh, is not showing any improvements on the antibiotics, we need additional medications. I talked about that if the red flags are present, we do the endoscopy in those patients, and further we go as well. I have talked about the dyspepsia approach, and I have finished this lecture. Uh, Thank you for your attention. So hope to see you in next videos.